Good afternoon, everyone. I'm Dr. Susmitha Gajula, consultant psychiatrist, Apollo Hospitals, Visakhapatnam. Today we are here to discuss about tobacco and smoking and its addiction, what are its effects. So, what is smoking? What is tobacco? No person will feel that smoking is an addiction. It will cause some harm to our body. So what actually is, what are the facts about tobacco is? It is one of the leading and preventable cause of many of the illnesses and also even death. It is considered as one of the most powerful predictor of smoking even during adolescence, even nowadays increasing before 10 years of age, particularly in low-income countries. Due to steady population growth and also industrialization of cities, millions of people are being addicted to tobacco. According to statistics worldwide, by 2030, it is estimated that more than 80% of the world's tobacco-related deaths have been recorded mostly in middle and low-income countries. So coming to the statistics, particularly in males aged about 12 to 60 years of age, 55.8% currently using tobacco. In women, 2.4% smoke and 12% chew tobacco. Among adolescents group, 2 out of 10 boys and 1 out of 10 girls use tobacco products in various ways. In nowadays, before 10 years of age, also increasing use of tobacco has been recorded. In what ways tobacco can be used? Many people do know that they smoke in the form of BDs or cigarettes, etc. Along with that, many people use in the form of chewing or applying or sucking, etc. Out of which in India, most common is BD smoking, followed by cigarette smoking. And also, chewing palm, the BT leaves with tobacco, it's considered as a smokeless tobacco. And also using dried tobacco, areca nut preparations, for example, pan masala, gutka, mawa, etc. They are very popular, particularly in villages side, and they are highly addictive. These are some of the forms of tobacco products that are used. Tobacco is available in smoking form and also smokeless forms. In smoking forms, most of them know BDs, cigarettes, gutkas, chutta, reverse smoking, hookahs, chillums, etc. Smokeless forms like pan masala, gutka, khaini, mawa, snus. These are the smokeless forms. So why do people smoke? What happens when we smoke? Many people feel that, for example, during the teenage, they feel that smoking is like a symbolic act. For example, they feel that they are not a mother's child, they are independent, they want to do some adventures with the peer groups. They feel that, for example, they feel that modeling, seeing person who models, who smokes, that they do want to do the same act. Like this, they start that. It starts in like a psychological mechanism. But later on, it goes to the pharmacological effect. It causes some physical effects on the body, and then the addiction goes on. So how does this initiation occurs? In many ways. For example, most commonly, the addiction starts in adolescent age, around 10 to 15 years of age. As a result of curiosity, they feel that they're very curious. What would happen if we smoke? My father is smoking, my friend is smoking, my relatives are smoking, so why can't I? They feel that like that. In teenagers, they feel that smoking makes them a man. So I feel like a man if I smoke. That's how it starts. And also in the peer pressure. For example, if they have a group of friends who smokes and they want to join in that group, so they feel that smoking makes them friendship closeness to those friends. They start doing that. And also sometimes the friend peer pressure forces them to do that. In this way, they start smoking. And also seeing ads in TVs, movies, uh, or ads showing most glamorous women using tobacco, smoking, or in many other ways. They feel that it makes them cool, looking very beautiful or handsome in smoking, taking photographs with that, videos with that. So it makes them popular. Some persons may feel that smoking helps them to relax, helps them to concentrate on their work. But actually, what happens is it has the opposite effect because of the various chemicals present in it. And later on, after a long time, it can lead to addiction. So once you start smoking, you cannot stop that. What is addiction? Why it is so important to know about smoking and what are its effects? So coming to the addiction, we call it as dependence. Once we take a substance, whatever it is, whether it is smoking or alcohol or ganja, heroin, whatever it is, it initially causes psychological problems. For example, feeling happy, pleasure about that, they get more energy, they're able to do their work like that. But later on, that's how the behavior starts. But later on, it can cause the physical effects. For example, they get the shakiness of hands, sweating, headaches, loss of appetite or disturbance in their sleep. All these come together, they are being addicted to that. We call it as dependence. In medical terms, it's the definition of dependence, a cluster of physiological, behavioral, and cognitive phenomena in which a substance, whatever it is, alcohol, smoking, whatever it is, it takes the higher priority for the given individual than other behaviors. For example, a person can feel happy when they're having chatting or doing some activities with the family members. But once they got addicted to smoking, they avoid the gathering and go outside of the house, smoke, and come back again. Like this, the goes on. They leave all these enjoyment behaviors that usually they used to have previously. But now they leave all that, go out of the house or go out of the work, leave all the other friends, get smoking done, and then come back. Then we call it as addiction. So if a person comes to a mental health professional, so to diagnose that, we have many of the criteria to diagnose whether the person is addicted to the smoking or not. For example, having strong desire, called as craving, to take smoking, and also having loss of control. For example, the person might start that I can control after taking 2 puffs of cigarettes, but later on, once it started, he cannot control that. He may end up taking 10 cigarettes or 20 cigarettes on that day, like that. And also, if he doesn't take any cigarette, if he stops that, he might get withdrawal symptoms if he doesn't use that. And also salience, tolerance, and also persistent use despite harm. For example, even though he is having some heart problem, some diabetes or hypertension, despite knowing that he is having some physical problems, he cannot stop using smoking. All these put together, it is called as addiction. So why it happens? What happens if you smoke to the body? What is so wrong to smoke? Particularly in adolescent age group, people cannot understand. If we advise them, what is wrong with that? To know that, we have to know what is addiction, what happens to the body when we smoke. For that, smoke, the tobacco products, whatever it is smoke form or smokeless form, whatever it is, it contains many of the hazardous chemicals. It is known that tobacco contains more than 4,000 other hazardous chemicals in it. For example, here are some of the examples like butane, cadmium, methanol, carbon monoxide, arsenic, methane, nicotine, etc. All these products, some of them are considered as air pollutants, some of them come under industrial components, whatever it is, they cause harm to our body. Out of which nicotine is the major component in the cigarettes. That is really important. So what happens? What nicotine causes to our body? When a person smokes, around 10 seconds, within seconds, through the respiratory tract, it reaches brain, through the blood circulation. So in the brain, it acts on various ganglionic neurons and starts secreting two chemicals. We call it as dopamine and noradrenaline. Dopamine is called as pleasure chemical, which causes pleasure in the person who starts smoking. Everyone will feel very happy after smoking. And also noradrenaline, it causes alertness and energy. Many persons say if they smoke, they can do work more. They can concentrate on the work. It is because of non-adrenaline. Initially, they might feel good because of these chemicals that released when they start smoking. But later on, once they stop smoking, the level of these chemicals, dopamine and noradrenaline, starts decreasing in their brain. So with that, the pleasure that they have experienced when they were smoking will get decreased. So to get that pleasure, they want to start another cigarette, they light up another cigarette. When this behavior goes for a long period of time, with increasing number of cigarettes, along with the psychological effects, that lack of pleasure, they will get another symptoms also. For example, lack of energy in their body, headaches, lack of appetite, disturbance in their sleep. To relieve from these symptoms, they start to take more and more number of cigarettes later on. Like this, the addiction starts. So what would happen when the addiction starts? What effects that tobacco can cause, nicotine can cause to our bodies? It is known that not a single part of our body is spared from harmful effects of tobacco. In what way? As I mentioned earlier, there were more than 4,000 toxic chemicals present in the tobacco. Many of them are known to cause various cancers. Most of the people you might have known that smoking causes lung cancer. Not only lung cancer, it has resulted in many other disorders like strokes, heart attacks, blood pressure, increase in blood pressure, oral cancers, stomach cancers, etc. And also smokeless tobacco, for example, gutka, kani, snus, etc. Many people don't think that it is an addiction, that it will cause harm to our body. Because even though they take gutka and not taking cigarettes, whenever someone advises them not to take gutka, they will say, I'm not smoking, so there is no harm to our body. It's not correct. Smokeless tobacco also do cause many of the disorders in our body. One of the most common causes oral cancers. It is also noted to cause many other cancers as well. These are some of the major harmful effects that the nicotine can cause to our body. Coming to the central nervous system, person can feel lightheadedness, getting headaches frequently, sleep disturbances, even though sometimes abnormal dreams, getting irritable even for trivial reasons, so that they can argue with the family members, frequent quarrels in the family, feeling very dizzy, unable to concentrate on the work, problems at the workplace also. Coming to the heart problems, increase in heart rate, arrhythmias, hypertension, coronary artery diseases. It can cause some hormonal changes in the body leading to the insulin resistance and diabetes mellitus. Muscles can become weak, joint pains, and also gastric ulcers, dyspepsia, diarrhea, nausea, even gastric cancer also. According to statistics worldwide, smoking-related deaths are reported as 4.9 billion deaths currently per year, out of which 40% are in developing countries. Whereas it is estimated that by 2025, 10 million deaths per year are related to smoking, out of which 70% are in the developing countries. Currently, according to the statistics, women are also taking cigarettes in higher amount than previous. Not only cigarettes, many of the women do take smokeless forms like chewing gutka, slimes, kines, etc. So when they take tobacco in various forms, if they become pregnant, it might cause some of the problems. For example, it might cause stillbirths, miscarriages, the baby placental circulation may not be good enough. It can cause low birth weights. Even though children born, mothers to the mothers who are taking smoking or cigarettes in any form, after their birth, there can be some developmental delays. They can face some of the behavioral problems and also problems in their learning and also emotional problems. Not only the persons who are smoking, the persons who are around them, we call it as second-hand smoking or passive smoking. For example, in a family member, the one person smokes, and if he sits around the other persons like his wife, children, etc., they get exposed to that smoke, or in the workplace, or among with the friends gatherings, etc. So they also inhale the same air. So through that, they do get some of the problems. We call it as passive smoking. In children, if they also cause some of the problems, like in children, it can cause sudden infant death syndrome, respiratory distress, or ear problems called otitis media. In adults, it can lead to discomfort, distress, and also if they're already asthmatic, it can exacerbate that, or it can lead to asthma in future. It is reported that even in passive smokers also, nicotine is detected in the blood and also urine. And also, there is an increased risk for passive smokers. It can lead to various cancers. For example, carcinoma of the cervix in women, carcinoma of the lungs, coronary artery diseases, and various list goes on. So knowing all these things, so it is high time for every person who smokes to stop smoking. So there are a lot of reasons to quit tobacco in various ways. But sometimes people may feel very difficult to do that. Sometimes they can do by themselves, even though they are successful for temporarily, but they get relapse again and again. So what to do for that? Anyone who smokes has good reason to stop. It is advisable, not even a single puff is good for health. So no matter how many cigarettes you take, how long you are taking that, what are the health problems that you are having now, once you quit smoking, it will help you to regain your health. What are the problems that you are having might come down. You will feel better and also breathe easier. So many people feel it's very hard to break the chain of smoking that they are having for long period of time. But you can do it with help of health professionals or by yourself, and also support from the family members, friends, co-workers, etc. Many of people have become successful in quitting smoking. You can also do that with the help of all these persons. So what are the benefits you get if you quit smoking now? After 20 minutes, if you stop smoking, your blood pressure and pulse rate return to normal. And after 8 hours, your blood nicotine levels, carbon monoxide levels become to half, oxygen levels come back to normal, which will help you feel better. After 24 hours, carbon monoxide is completely eliminated from the body and lungs start to clear the mucus, etc. After 48 hours, nicotine is completely eliminated and the sense of taste and smell becomes much improved. Whatever the food that you are used to avoid while smoking can be better tasted and you may feel happy now. After 72 hours, breathing becomes easier, the bronchial tubes begin to relax, energy levels come to increase. In 2 to 12 weeks, the circulation improves. 3 to 9 months, if you are already having coughing, wheezing, or breathing problems that you might have, it starts improving in little way as time goes on. After 1 year, the risk of heart attack that you have might get halved. After 10 years, the risk of lung cancer get halved. After 15 years, the risk of heart attack equal to the person who has never smoked. And also the pregnant woman. The woman who is smoking or taking tobacco in any form, if they are planning for pregnancy, it's advisable to stop taking tobacco at least 3 months before pregnancy. It will help you to avoid the maternal defects that occurs in the baby. Your risk of having a baby with low birth weight is same as that of a woman who does not smoke if you quit taking tobacco first in the previous 3 months of your pregnancy. Since some women who now has not quitted the tobacco and also became pregnant, they can still reduce the problems for their babies if they quit tobacco even later in the part of the pregnancy. So after knowing all of this, sometimes by themselves or by advice of the family members, they try to quit. But many persons may feel difficulties in stopping smoking. So what is the reasons for that? First, The foremost thing is craving. They have a strong desire to take smoking. They might think, this is the last day, I can take 2 puffs, 3 puffs, that maybe tomorrow I can take 10, tomorrow is the last day for me. But they cannot stop that. They may lose control on that. And also, even though they try to stop taking cigarette, they can have some of the withdrawal symptoms. For example, feeling very sad, not able to do work, trouble in getting sleep, increased appetite, headaches, getting irritable even for small reasons, being restless, being fatigued, feeling very weak on that. Because of all this, they start taking another cigarette. If they take the cigarettes, all these symptoms might go down. They can feel energetic, so they start taking again. Because of all these symptoms, they find very difficult to quit smoking. To avoid all this, we have some of the options to help you. Mental health professionals, it is advisable to take help from health professionals to avoid all these things. So in what way? We have goals. For example, short-term goals. When the person comes to the health professional to take help, first initially doing some interview techniques, assessing in what stage the person is, whether he's willing to stop smoking or whether he's not willing to do that, if he's willing, in what stage he is, and applying the relevant strategies at that period of time. And the ultimate goal is long-term abstinence from smoking. So what are the interventions we have? One thing is non-pharmacological. For example, non-pharmacological means counselings, psychoeducation, brief therapies, motivation interview techniques. They're extremely important to help patient getting confidence and also getting motivated to stop that. Along with that, pharmacological interventions maybe given for some persons who find difficulties in coping up with the withdrawal symptoms. So what are the interventions? We have 5 A's of smoking cessation. What are these? Ask, advise, assess, assist, and arrange. So what are these? When the person comes, initially ask what to ask. Do you smoke or not? If yes, if they smoke, so what do you smoke? How much and how long they are doing? How they feel when they smoke? How they feel when they do not smoke? Whatever is relevant to the related to smoking, everything need to be asked, and then advise them in what way. So what are the disadvantages the person is having due to smoking? So what is addiction? What is tobacco? What are the contents in the tobacco contains? What would it cause to the body when the person is smoking? Need to advise regarding that. What are the advantages and what are the disadvantages regarding smoking? And then assessing the person whether he is motivated to quit or not. Depending on that, assist the person creating the quitting plan. For example, setting a date, helping him to do that, and also involving family members and friends to help him, and also arranging the follow-up plan if quitting within 1 week or so. Along with 5 A's, we need to do brief interventions, psychological interventions. For example, it can be done in a individually or group psychotherapies. In individual psychotherapy, depending upon the person, if he is willing to involve in the group psychotherapies, we can do in group psychotherapies or in individually. Advise all the current tobacco users to quit and advising them what are the advantages to do that. Educating, giving psychoeducation regarding tobacco addiction, and also giving him some booklets that are useful to him, advising him to use diary. Like in the diary, the person by himself notes that what to do, what not to do, what are the advantages, what are the disadvantages that he had, what are the current problems if he is already having, the person is already having, like he is already having any cancers, any strokes, etc. Depending upon that, giving counseling and also feedback to the person. If necessary, offering him some medications, encouraging follow-up. While doing that, motivation interview technique is very important for the person to get quitting. For example, when the person comes, initially we need to assess whether he is able to recognize that he is having a problem with smoking or not, whether there is a need for him to change or not. If he is not willing to do that, we call it as pre-contemplation stage. During that stage, if the person is in that stage, what a mental health professional can do is psychoeducation can be done, educating the person regarding addiction, tobacco, the harmful effects, and also educating the family members also, not confronting the person that he is not doing the right one. In a very empathetic way, advising them what to do, what not to do. And then going to the contemplation, giving time for him to think about that. And also in next goes to the contemplation stage. In that, person is able to recognize that he is having some problems with smoking, or otherwise he's already having some problems, has already faced regarding physical health problems or financial issues or family problems in the family, having frequent quarrels about his habits. So he might be in a dilemma whether to stop or not to stop, what to do, what not to do. In that stage, we can advise him what to do, encourage him to stop smoking in various ways. And then coming to the action, in that the person is completely motivated and he wants to quit smoking. So already he has started initiation to change. So many of the people, mostly they get successful by themselves without reaching a health professional's help. Sometimes some people get difficulties in that. So depending upon the stage, that we can advise either through the psychological counseling or through pharmacotherapy. And once they have stopped taking smoking, it goes to the maintenance stage, for how long he was like that. Advise them to have some lifestyle modifications if necessary and sustain that behavior for a long period of time and abandon that risky behavior completely. Sometimes during that maintenance period, they may face some difficulties and relapse again start smoking, maybe after 3 months, maybe after 1 year, maybe after 2 years, depends. Again, the person might go to the pre-contemplation stage. So by assessing the person and knowing at what stage the person is, depending upon that, we can give different strategic counselings. So what to do when the patient is willing or motivated to stop? We can devise a quit plan. So what to do? It depends upon it is advisable on the patient side, and also support from the family members is really very important. What we will do is set a quit date, usually within 2 weeks of what the person want to do, and then advise friends or family members or co-workers who will be advise them to understand what the person is going through and what way we have to support the person who wants to stop smoking. And also ask him to maintain a diary. In that, if he has already previously attempted by himself without any health professional support, so what are the triggers that he had again to relapse again? So planning a quit attempt. Particularly, this is very important first few weeks because of withdrawal symptoms or because of the cravings or because of the society, he might again go back and take cigarettes again. So we have to anticipate those challenges and advise him alternative measures other than smoking. And the most important thing is remove tobacco products from his environment, whether in the home or in the workplace, whatever it is. Finally, advising total abstinence is very much essential. Many people will ask, only today a single puff before the quit date, then I will stop. But it is not advisable. Not even a single puff is advisable after the quit date. And past experience. This is really important. Most of the people will have 3 to 4 unsuccessful attempts to stop smoking. They say, madam, we have tried to do that, but we failed to do that in previous attempts. So if that is the case, we need to assess what are the triggers for him to relapse again and advise him how to successfully overcome them. And also alcohol. Many people do smoke along with alcohol. So taking alcohol can cause smoking again and again, and it will be difficult for the patient to do that. So limiting alcohol or abstaining from alcohol is also advisable. Other smokers in the household, mostly in the family, not only a single person, the maybe father, son, or grandfather, many of them can be taking smoking. So it will be very difficult if you go back home and some other person is smoking in front of you, and it will be difficult for the person to quit from that. So we should encourage the family members also to quit from smoking. So when the person is completely ready to quit that, we set a 5-day plan for that. So before the quit date, we have some of the options. Before the 5th day of quit date, list all the reasons to quit. We can list it in the person's diary and advise all the family members who are supporters to this person regarding this quit plan and support him understanding what he is going through. And is advised not to buy any of the tobacco products, whatever it is. Some may say like, now I have stopped taking cigarettes, I can take hookah or kani. It is not advisable. Completely stop buying all cigarette products, tobacco products. And in the 4th day, before quit day, pay attention and see why and when to use tobacco. And they say that cigarettes make them help to relax. So think other ways which make them feel happy, feel relaxed, and try to do those things. Change your habits, change your daily routines, make a list of the things about that, and try to do all those things instead of tobacco. 3rd day before the quit date, as you have stopped buying all the tobacco products, you might have some extra money in your finances. So try to make use of that money in other ways, and like spending with family members or buying some good things, etc. And also, if you need some help at the time, for example, you're having again cravings or having some withdrawal symptoms, so make an immediate arrangements to take some help from health professionals or from your family members. And also, if quit day minus 2nd day, get rid of all the clothes that have smell of smoke. It would be really helpful because the sight of smoke or smell of smoke or the taste of the tobacco products, it will make you relapse again. It will make you difficult to stop that. And before the day of quit day, if you can do all of the things, then reward yourself that you are going to quit. Your teeth must be clean, your clothes must be clean, all the tobacco products, including the lighters, matchboxes, ashtrays, etc., should be thrown away. And all the family members are advised to encourage him, a person who are trying to do that. On the quit day, change your routine, keep yourself busy to do things that makes you happy other than the tobacco use. Tell your family members that you have quit yourself, avoid alcohol, and next day, congratulate yourself to do that. By doing all these things, most difficult thing, if the person is taking for many years, long period of time, they might have some withdrawal features, which might make them difficult to control that. It requires some of the medications to help them. So combining these psychological interventions along with the medications, it can help you take more successful in quitting in long period of time. So what are the options that are available? We have nicotine replacement therapy. Nicotine is available in the form of gums, patches, lozenges, sprays, or inhalers. Uh, In India, we have gums, patches, and lozenges that are available. They're effective, safe than tobacco use. However, how much dose that we need to use, how much days we need to use depends upon the amount of tobacco the person is taking and how long he is taking. It is advisable optimum treatment for at least 3 months, but it varies, depends upon the person. And also, the likelihood of tobacco abstinence with nicotine replacement therapy in case of smoking is 1.5 times that of placebo. Combination of these NRTs like gums, patches, etc. can be tried in refractory cases. So in what way and the dosages? Nicotine gums or lozenges, they are available in 2 milligrams and 4 milligrams. So depending upon the number of the cigarettes the person taking, if there is less than 25 cigarettes, it is advisable to take 2 milligram of gums every 1 to 2 hours. More than 25 cigarettes, it is 4 milligrams every 1 to 2 hours. Maximum, it is advisable to take 24 grams per day. And the duration is around 12 weeks with gradual tapering. How to take that? We call it as chew and park method. Like the gum is taken and chewed until the tingling or peppery taste occurs. And then park that gum in the gap between your inner cheek and the gums. Continue till the sensation stops. It will take around 30 minutes. And you can keep that gum in the mouth for at least 1 hour before spitting out. And also it is not advisable not to drink anything 30 minutes before or after taking the gums. Usually it is safe. Some people may complain having mouth irritation or numbness in the tongue, jaw fatigues and dyspepsia, etc. But they are short term. It is very effective in controlling the withdrawal symptoms that the person is experiencing. And advantages, it can be started even before the quit date. And the person can control the nicotine dose depending upon their cigarette usage. These are some of the gums that are available. Nicotine patches. They are available in 21 milligram, 14 milligram, and 7 milligram patches. The dosage also depends upon the number of cigarettes. If the person is taking more than 10 cigarettes per day, it is advisable for 21 milligram per day. Less than 10 cigarettes per day, 14 milligram per day. Around 10 to 12 weeks of duration, the gradual tapering of the patches. One patch can be taken for one day, but it is not advisable to stop taking the patch abruptly. Gradual tapering of the dosage is very essential. Where to use the patch? It is applied on a clean, dry, non-hairy areas over the shoulders or arms and like that. Pressing the patch over the skin and pressing the margins of the patch. Some people may complain of local irritation, burning sensation, or tingling when the patch is applied. Later on, when the nicotine starts absorbing in the body, some may complain of headaches, vomiting, diarrhea, dizziness, redness or swelling at that patch area. But however, all these symptoms are very short term. It goes within a while. The other ones are nicotine inhalers and nicotine nasal sprays. Nicotine inhalers available in cartridges. One cartridge, 10 milligram cartridge delivers 4 milligram of nicotine per spray. Usually, it is advisable 6 to 16 cartridges per day initially. One cartridge every 1 to 2 hours. Around 12 to 24 weeks duration is necessary for this treatment. In this, how to take that? Patient should inhale back into the throat through the cartridges and puffs in short breaths. Open cartridge retains potency for at least 24 hours. No food or beverages are advised 5 minutes before or during the use. Some people may complain of mouth irritation during that time, but it is short term. Delivers nicotine in very rapid way. Another one is nasal spray, which is a very fast delivery of nicotine, most rapid delivery. One spray of nicotine nasal spray contains 1 milligram of nicotine. Initially 1 to 2 doses per hour, typically getting at least 8 to 40 doses per day depending upon the cigarette usage. Other than nicotine, we do have some of the medications, non-nicotine pharmacotherapy, like varenicline, bupropion, some of the antidepressants like nortriptyline, other drugs like chlorine, etc. Out of which varenicline, the dosage is in first 3 days, it is 0.5 milligram once daily, and then 4th to 6th day, it is 0.5 milligram twice daily. After the dose is gradually increased to 8th to 12th week, 8th day to 12th week, it is 1 milligram twice daily. It is started 1 week before the quit date. Usually well tolerated. Some people may have some stomach upset like nausea and also some sleep disturbance. Other drug is bupropion. The dosage is 150 milligram per day for 3 days, and then the dose is increased to 150 milligram twice a day. It is also started 1 week before the quit date. However, it is not used in the persons who are having seizures because high doses can increase the risk of seizures. Some of the common symptoms that persons might experience while quitting smoking. So some self-help measures that we can do by ourselves to avoid all those things. For example, if the person is getting irritability, advised to have a small walk, hot baths, or relaxations, what helps him to relax by himself. doing some yoga or meditation. Some may feel good with watching TV or listening music. To do that, to help yourself. And also, if the person feels fatigue, taking some nap, going to exercise. Insomnia, if the person is having insomnia, avoid caffeine after 6 p.m. If they're having any cough, drinking plenty of fluids, taking cough syrups. If they feel dizziness, change position slowly, taking plenty of water. If they're having problems with the stress, with work, not able to concentrate. So planning the work, getting advice from the doctors, from the having problem solving skills, avoid stress. If they're having constipation or gastric problems, taking plenty of water, adding fiber to your diet. Or if they're having problems with weight gain or hunger problems, having low calorie diet, planning their food, everything. Most important is cravings, waiting for the urges. Try to postpone that. Distracting yourself by taking some water, some chewing gums, reading books, doing exercise, listening to music, or talking with your family members, etc. If you're having any headaches, drinking plenty of fluids, relaxation, and eating small snacks, etc. Even though a person can experience all of the symptoms or can have only some of them, whatever the symptom that person can be experienced, these symptoms are very short term. So no need to worry about that. As the levels of nicotine decrease in the body, these symptoms also go off. Most important thing every person says that they try to quit smoking, but they again relapse. So what are the main reasons? What are the possible obstacles that they get in future that to relapse again? Mainly is because of withdrawal symptoms, craving, lack of support from the friends or family members, gaining weight, getting depressed, or having any other mental illness. It is really important to know whether the person is having any other comorbid mental illness or not. For example, having depressed, having other substance abuse, for example, taking alcohol or ganja or cannabis, etc., or having any other mental disorders like schizophrenia, bipolar disorder. We need to rule out that also. And missing the pleasure of tobacco. So, what to do? Preventing the relapse is most important. Encouraging the person to report problems as early as possible. Even advised, the family members are advised to note down what makes the person to relapse again. And then seek help for that. What to do to avoid all these things? Having a schedule appointments, even if necessary. We can come to the health professional even before that, schedule appointments. Keeping the patient motivated by themselves, and also family members can help the person to get motivated to a person by saying what are the benefits that they got after stopping smoking, what are the present experiences, what are the past experiences that they had, what are the threats to stay smoking, of staying stop. These interventions can be used in every encounter with the patient who has already recently stopped smoking. Making lifestyle changes, time management, reducing stress, improving the quality of life, keeping oneself busy, managing cravings by distracting themselves, drinking a glass of water, taking some chewing gums, or increasing problem solving skills. Identify the high risk relapse situations are very important, particularly peer pressures, society, or the places where they go in workplace or any other things, whether they go to the places where tobacco is much available, avoiding all those things, avoiding alcohol, and motivating oneself by I can do it. Encourage yourself and self-visualize yourself as a non-tobacco user. After quitting, you can congratulate yourself, saying that you have done a good job, staying very active, drinking very lot of water, doing something that you are not connected to tobacco in any way. Take deep breaths, avoid high risk situations, avoid alcohol, coffee, avoid being around people who are smoking. This is just a saying about a smoker's prayer. Thank you for not smoking. Thank you. It's open for questions now.